welcome in Woodbury Dental Arts. I'm Dr. Marko Kamel. Answering the question of how can a dentist treat sleep apnea? Sleep apnea is very related to how your jaw is positioned during sleep. So we have multiple of devices that we can use to advance your jaw forward, and that can create more space for you to breathe through while you're sleeping. So looking through some of these pictures show you the amount of oxygen that gets through your nostrils and mouth while you're sleeping, and the amount that can get more after advancing your jaw forward. The devices that we use for such a thing are several, and a couple of them I'm having here, like the Moses, and also this is a picture for the Somnimat. Thank you.